ladies and gentlemen, they are finding a new side effect for people that are getting the COVID-19 vaccine. It's mimicking breast cancer. And these doctors are trying to say this is normal. This is normal. And then we know darn well it is not normal to feel like you got breast cancer after getting a vaccine. If you don't get out of here. So, this is USA Today, February 26, 2021. Doctors recommend patients schedule their mammogram before receiving a COVID-19 vaccine. So, this is just mounding up the medical bills, and the medical industry is now benefiting again, because if you feel something in one of your breasts, you're going to go get it checked out. So now this is another moneymaker. So there have been women mistakenly believing that they were feeling lumps when it was just swollen lymph nodes due to the COVID-19 vaccine. These swollen lymph nodes also show up on mammograms and other types of imaging scans, experts say. There have been a couple of situations where patients went for a mammogram and it was right there. And the doctor almost thought it was breast cancer. Mm-mm-mm. Lymph nodes are a specialized tissue of the body's immune system that contains white blood cells and help in fighting against infections and disease, according to the National Cancer Institute. They are normally the size of lima beans and all over the body, but most prominent are the lymph nodes that are located in the armpit, neck, and groin area. The ones located under the armpits are more likely to swell after getting the vaccine because they're the closest to the injection site. They could begin to swell as soon as, they're talking about within days of you getting the vaccine. And they said the swelling can go on as long as 12 weeks. That is crazy. But they're saying this is normal. this is normal, y'all. Additionally, the vaccine shouldn't create any abnormalities. If they're saying that you should not be able to physically look at yourself and see anything abnormal. So that's pretty much what they're saying. So, you know, anytime somebody is a medical expert and they're telling you this is normal, I don't trust them. I'm sorry, I can't trust you. Okay. But health experts emphasize that this is completely normal, as increased inflammation suggests antibodies are at work protecting the body against SARS CoV 2, the virus that causes COVID 19. This is a normal immune response to a potent vaccine. I just can't even take these people seriously. To be expected. It is a well desired consequence of a vaccine. Now, I've gotten vaccines before, and I don't remember anything like this happening. I'm just telling you. Okay. So, other vaccines, similar response, such as the influenza and the human papilloma, they're claiming that these things will occur when you get those shots too. Funny, I never heard a lot of people talking about that. So we know about the side effects: low grade fever, chills, headache, fatigue. Well, now there's a new one, y'all. Mm-mm-mm. It's possible the potent mRNA vaccines are causing swollen lymph nodes at a higher rate than other vaccines, as they appear to cause more side effects. Dr. Jessica Lang, okay, at the University of Texas, Anderson Cancer Center. Mm-mm-mm. It's a scary time. Cancer patients are frustrated at states making them wait for the COVID vaccine despite federal guidelines, even though swollen lymph nodes could mimic a certain lump. During a self-examination or mammogram, it is still important to get the COVID-19 vaccine and screened for breast cancer. So they're finding a way to get you out there and making more money for the medical industry because of these side effects. I mean, that's really all it's doing. Most providers can tell the difference between swollen lymph nodes and something that is worth concern, especially if they know the patient has been vaccinated against COVID-19 in recent weeks. Lang and Bernstein know how difficult it is to get a COVID-19 vaccine as supplies is still limited. So they advise against rescheduling your appointment to get vaccinated. But don't forget to get your mammogram. Even with this, because cancer is still a big problem in this country. And this is a test that can potentially save a woman's life from breast cancer. Wow. No, what it's really telling me is just explaining more about why I'm not going to get this thing. Mimic breast cancer? Wow. Wow. I'm sorry. I have seen and talked to even relatives that got vaccines. I have never heard this one before as a side effect. This one by far is definitely different from the norm, y'all. But please tell me what you think about this story from USA Today. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.